Guys, welcome back to Medical Coding with Blue. Today's episode is all about advice for on the job for new medical coders. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. On the job advice for brand new medical coders is what I meant to say. But the thing about it is, guys, if you have gotten your first job in medical coding or a coding adjacent position, this episode is for you. So, congratulations if this is your first job. And I know that it can be very overwhelming. For the next 3 months or so, it will feel very overwhelming because you're like learning a lot of new things. The electronic health record, their processes, the facilities processes, and you're going to be learning about all your coworkers and about your providers. And this is all just part of the deal, okay? So, first thing is first. The thing that you should understand is every single veteran coder or the coders that you're going to encounter all have different views on new coders. For some, they're excited to help with a new coder, and for others, no one trained them, so they don't feel like they should help in training you, okay? So whichever direction your facility is, if you're working in a facility, that's what you need to expect, okay? If you get a nice and friendly person who's willing to handhold you and walk you through, that is fantastic. You are blessed more than you know. But if you don't get it, I don't want you to be discouraged, okay? It's not personal. It's just how some people feel. So with that said, we need to make sure that we arm ourselves with knowledge and references as far as like where can we go for help if we don't have help on our team, okay? We need to be able to help ourselves. How do we find help? If you're working with an encoder, that encoder, usually you can click on a stack of books for like a reference, and it'll bring up Coding Clinic or CPT Assistant, and so that way you can start looking through those. And Coding Clinic and CPT Assistant are basically like when people write in very difficult type of scenarios, and they're there to offer advice, and these are the people who actually write these books, these editors of these books, and so they're answering these questions. And so that's a good place to find a lot of like weird and off the wall type of scenarios and situations to kind of help you to build your knowledge. The thing that you don't want to do is you don't want to be running to your lead or to your supervisor every 5 seconds because you don't understand something, okay? It's okay to struggle a little bit to figure it out because you will. You need to just give yourself that. But if you are going to go and ask your supervisor or lead for help, you need to make sure you have a pen and paper with you. Always take notes. Always take notes. Because whenever I encounter somebody who's new and who comes to me to ask a question, if I see them without a paper, I will give them one chance to do this to me, because it is very frustrating when you have people who think that they can just take your time and, you know, it's not a big deal because you're helping them because they're new. No, you need to be respectful of other people's time, especially to veteran coders, because again, you don't know how their attitude is going to be about helping you, okay? So that's just what I want to say there. But take a pen and paper with you and write down the things that they say, all right? And so when you're looking at these notes and you're actually sitting down to code, the important thing is you need to ask yourself, what bought the bed? Why did they come to the hospital? Why did they come for an outpatient visit? You need to ask yourself that question. Identify it in the record. If they say that they're coming in because they fell down and they're in pain, their ankle hurts, and then after they go and they look, they do an x-ray and they talk about the radiology in their note, and they say, okay, they have a fractured bimalleolar ankle fracture, right? That's what they have, is a bimalleolar ankle fracture. And so that there you have identified your diagnosis, because we know they came in with an injured ankle, but we need to know, okay, well, what happened? It could be a sprain, it could be a laceration, it could be anything. In this case, it's a fracture. So we've got our first diagnosis. Now, how do we decide, like, okay, like, where are they? We apply the rules of injuries. And if you don't know what they are, you can reference the coding guidelines for that, okay? But, you know, you gather up that information there. If it's an initial, treatment or if it's a subsequent. And again, you can find out the differences in the coding guidelines, or if it's a sequela, okay? So those are the options that you have. But then you're reporting that. How did it happen? That's another diagnosis you're going to be picking up as well. So those are things you need to kind of look out for. Is there anything else that the provider addressed, or they assessed, or they treated, or it was part of their decision-making process? If the person that fell down and they fractured their ankle, are they a diabetic? Let's just say they are a diabetic. Then if the provider says, well, I checked the patient's blood sugar is okay, there's no visible sores on the ankle, so we're going to go ahead and apply a cast and that kind of thing. So that's another diagnosis you would want to pick up, because that diabetes was part of their decision making and part of their, like, what did they have to consider about this patient? Because it's not just one thing that's often affecting these patients. Sometimes it's a lot of other things, and sometimes it is just one thing. It just depends on the person. But we need to think about it in relation to how did it affect the provider's ability to be able to think about the treatment plan for this patient, okay? Now, if you say, well, Blue, there's a whole like problem list of problems, do I pick all of those up? No, you never pick up from a problem list. I talked about this last week. Problem lists are a dumping ground for diagnosis that the patients have come in with. So that's just something that you want to avoid altogether. There is a coding clinic about that says you do not pick up from the problem list, because again, we don't know if these conditions are current or not. And so that's another thing that you will learn on the job. And you will learn how each one of your providers documents, because they will all document in their own way. And sometimes, you know, if they're trained well, they'll be consistent, but there's always going to be that one rogue provider that is going to be doing things their way. But that you will learn, okay? But those are the main things that you're going to ask yourself, is what brought the patient in? Was there any other conditions that were affecting this patient that would affect the care that the provider had to give for that patient? Okay, then you're going to be looking around, did they have any procedures performed? And if that procedure was performed, was it a major procedure? Was it a minor procedure? In the example that we have, where we talk about a patient who has fractured their ankle, if a provider puts a cast on that fracture, because that's how they're going to treat it, they're going to close, well, it's a closed treatment if it's a closed fracture, right? But if they don't have to reduce it, they just basically put a cast on it, you can report that the fracture treatment without reduction or manipulation, so that way you can go ahead and report that. But that is a major surgery. Even though the provider doesn't take the patient up to the floor, they are still there in the clinic. That is still a procedure that has a major global period. So it's a 90-day global period. Those fractures and dislocation, when they have to modify those, well, they modify, but when they when they take care of the patient and they're reducing the dislocation is what I was trying to say. Those are major procedures, okay? So those are things that you have to be aware of and understand. And a lot of times you have to look at the encoder to kind of help you too, because the encoder will, when you put in a procedure code, it'll often have like three little digits after that code, right? It'll describe the code, and then it'll have like brackets, and then it'll say 0100000 triple X, or it will say 090. If it says 090, we know that's a major procedure, right? And so, okay, we know we got that. We're reporting that code because the documentation supports, you know, the application of that cast, and the E&M is going to be based on whatever they documented, but we need to look at the E&M tool and decide, okay, well, we know this is serious because this is a major procedure. And so we're looking at a moderate in that, at least in that kind of category. Sometimes it could be high. Depends. It depends on, again, what happened to the patient and what they're coming in with. Because sometimes some patients are higher risk. That's another thing you want to look for in your notes. If the doctor's indicating anything is high risk, that needs to be like an alert for you to be like, okay, there's high risk here, because adding high risk or a patient that has high risk, that's going to change the level that you can give to that provider. Okay, and again, it goes back to learning and reading about evaluation and management. So what modifiers are we going to apply? And in that situation, we're going to apply the E&M. Let's just say it's a 99204 because it's a new patient. 57 modifier because decision for major surgery. If a surgery is done either the same day or within 24 hours, that is a modifier 57 added to that evaluation and management code, because it's telling the insurance company, hey, this patient had a major procedure and the decision for that procedure happened today and we did it the same day or within 24 hours, and here's the codes for that. So that's something that you ought to know, right? And again, if ortho is not what you're doing, maybe it's the ER or maybe it's primary care, you need to think about that. You need to know all these things. Again, you're looking at what is bringing the patient in, and that's kind of what's helping you. And yes, I know it is a lot to be new. I know it is a lot to be new, but it's exciting too, because you'll start to feel that pride in yourself, especially when you say, okay, I recognize that they had a surgery or a major procedure done in the clinic. I recognize that I need to add a modifier 57, or if it's a minor procedure and I need to add a modifier 25 because it's unrelated, right? There's something else going on. But there's a lot of different rules, and if you're able to kind of figure that out, like in this instance, adding a modifier 57 to that E&M level because of the procedure, and then adding right or left to that fracture treatment code, again, that's going to make you look great, okay? Because it's all a matter of just looking. And don't feel the need to rush in the beginning, because you need to get your bearings. Don't go overly slow, but also make sure that you're keeping pace, okay? I know that's kind of hard, but don't feel like you need to rush, okay? You need to look at everything, complete it, and then go. And after a while, you will start to pick up the pace, okay? Now, if you're doing 1 or 2, 3 a day, come on, man. You're just going too slow, okay? And they know that they need to watch the encounters that you're pushing through. So kind of take a little bit of like peace in that, all right? But again, we need to make sure that we are thoroughly looking at these notes, so that way we know, okay, this is what they came in for. This is the codes I'm going to pick up. If you get stuck, and you absolutely get stuck, then go and ask your supervisor or your lead, whoever. Make sure you take notes. Take a paper and pen with you, okay? So that way you can do that. But that's a big part of your first 90 days, right? And the other thing is you're going to be getting to know your coworkers. Now, when you get to know your coworkers, you don't need to be sharing all the things that's going on. You don't need to be complaining about anybody or how hard it is, or doing anything, because you never know who you're talking to. You don't know if you have a friend or a foe, because sometimes some people will look at you and smile to your face and kiki with you, and they are, oh yeah, and they're gonna support everything that you say, and then they'll be right over there to talk about you behind your back. I don't want y'all to be paranoid, but I do want you to be prepared. And this is what a lot of people get kind of like lost in, like, oh, well, no, this is my friend. No, that friend may not be your true friend, okay? And some people will look at it like we're just coworkers and whatever. So that's the thing. You can't always trust. Now, sometimes it does work out. You spend a lot of time with your coworkers, you get to know them. But you don't need to be oversharing all the things that's going on with you personally. Don't be complaining about your old man, your old lady. Don't be complaining about your kids. Don't be showing off pictures of your kids, because when you start chasing around people with your pictures of your kids, some people may not like that, and some people may be like, oh yeah, I have a daughter too, or I have a son too, and my kid's this and my kid's that. You're there for a job, guys. You're there for a job. And yes, while it's good to connect with your coworkers and build those relationships, there is a boundary that needs to be maintained. And especially when you're brand new. It's different when you've had a little bit of time in. But when you're brand new, you need to keep it like very plain, very vanilla, very okay. I do gardening and I cook on the weekends. You know what I'm saying? Like that needs to be something that is very plain, okay? Because I've seen too many new coders get themselves caught up, and then all of a sudden, by the time they know it, everybody's thinking different things about them. And that's adding pressure when you're already under a lot of pressure at work, okay? So you can share a few things, but don't be oversharing, okay? And don't be out there sharing all pictures of your kids and things like that. And another thing, do not add your coworkers to your personal Facebook, Instagram, or any of those things. Don't do it. If it's LinkedIn, LinkedIn is fine. You can connect with people on LinkedIn, and that's fine if you want to connect with your coworkers on LinkedIn, okay? But don't be doing it for your personal social media, like personal Facebook social media, personal Instagram social media, TikTok, or any of those other things. Don't be doing that. Don't do that, because it causes too much problems. I had a new girl that came in, and I told her, because I knew her from another facility, and she came over to us, and I told her, I said, you got to be careful with some of these people. And I already saw her warming up to somebody that I knew was trouble. And I told her, I said, you got to be careful. You can't be adding people. It's not like where we came from, where, you know, everybody was kind of a little bit closer. It's not like that here. And she's like, oh no, you don't know what you're talking about. Sure enough, that lady went and talked about the lady that I knew. Bad. And not only that, that lady that I knew really thought that other lady was her friend. And I did all I could to stop it, just by telling her don't do it, but she didn't want to listen, and so that's what happens. And so, but again, I'm telling you this because I don't want to make anybody paranoid, but I just want people to understand that your work life is your work life, your home life is your home life. You do not need to, just because you work together, to add them to your personal Facebook. Okay, you can preemptively block people from your Facebook and Instagram and all the other good stuff. You can preemptively block them, because that's just to keep a boundary and to keep things separate. Okay, that's another thing that I would recommend. Okay, but I'm just saying that there. The other thing when you're first starting is you're going to get to know your providers. Now, you may be a little bit shy about that. The rules are different everywhere you go. For some places, we have somebody who educates the providers. If you're embedded in the clinic, which I hope you are, but sometimes you're not, but if you are, then you need to make sure that you are approachable, that you let them know, hey, I'm your coder. If you are their coder, if you know that Dr. Jones, for example, is, I don't even know what Dr. Jones, but if there's somebody named Dr. Jones, right? And you say, this is, I know I code for Dr. Jones, and you see them in the hallway. Oh, hello, I'm your new coder, my name is Joe, and that kind of thing. So that's the thing. You need to be able to connect with them, okay? If you are working remotely, which you should not be, especially when you're brand new, I don't care if you get mad because I say that. Here's the thing. It's hard enough to learn the electronic health record when you have no prior background in electronic health record at all. But it's hard enough to be at home trying to learn that remotely. And then now you have a non-existent relationship with your providers because you're insisting on working remotely. Now, if it is part of the facility and you had no choice in the matter, well, then that's something that's different. But if you are actively looking for, and you end up getting a remote position, and you think it's the greatest thing since sliced bread, it's not, especially for my new folks. When you have experience, then absolutely. You can work remotely all you want to. But if you're brand new, you have no business being at home. You need to be there so that way you can get that interaction time in. Because you're going to miss out on a lot of development. And for my folks that says, well, in 2020, I couldn't work in-house, and I've been remote ever since then, and I'm just fine. I guarantee you there's a lot of things that you're missing out on. There's a lot of development you don't have. And you cannot tell me, oh no, Blue, no, you're wrong. No, I'm right. Because again, You don't know what you don't know. And if you're missing out on that interaction with providers, if you're not developing that skill to speak with them and to speak with intimidating personalities, that becomes a problem later in your career. It's going to prevent you from moving forward and moving on and being able to reach new heights in your career. Okay? You don't want to be the reason that you stunt your own growth. Isn't that stupid? It is stupid. I'm just saying. But if you have a chance to meet your providers, say hello, shake their hand, look at them in their eye. Don't be all, don't do that. And don't say, oh, I'm sorry if you see them, right? Because you should make an effort to go and see them. I always make an effort to go lay eyes on my providers, especially when I get a new one. When I get a new one in, and I got 2 new ones coming in August. Oh, trust me. I go over there and I let them know, hi, I'm your coder. And then they go, oh, hey, how you doing? And I'm good. And a lot of them have told me, I've never had a coder come over to me before and introduce themselves. I said, well, so we are going to get to be good friends while you're here with me, because it's your job as the coder to educate them. Now, again, it may be different at your facility. Somebody may already be doing that. Somebody, does all the education for the providers, and, so the coders just code. If that's your situation, save your comment. I am talking to those who have that option. Or maybe nobody knows to do that kind of thing. Well, then you stroll up in there and you're working with these documents and you're working with these providers and you start to build these relationships. It is a lot easier than it looks. It's just maintaining and managing the waves of, hey, who are you? Because if you're going to query a provider and you've never introduced yourself, and that's another thing too. If you're working at home because you got no choice, then you need to be emailing your providers, especially before you query them. Now, if somebody else does the queries, which again, I think is stupid, but it does happen. Here's the thing. If you're the one who has to query the providers, then you need to make sure that you send out an email to all the providers that you're coding for and introduce yourself. Hey, I'm your new coder. I have a CCA, a Certified Coding Associate. I have a CPCA, a Certified Professional Coder Apprentice credential, and I'm very excited to be here with all of you. I am looking forward to working with you. If you have any questions, I am always available to reach out at any time. I can make time to visit in person if you like. And that's it. And so that way, when you do have to query them, they're not like, first of all, who the heck are you to be querying me? And I don't even know you. A lot of new coders will walk into that frustration of, well, I sent them a query and they got really mad at me. Well, first of all, who are you? Did you ever introduce yourself before you had to send this query? And a query is a question about their documentation. Maybe something is missing in the documentation. Maybe there's something that needs clarification. Maybe they said it was the right, and then all of a sudden the end of the documentation says it's the left. So which one is it, So sometimes you have to query the providers for those reasons. But it's good if they know who you are firsthand and first off, instead of just getting this mystery email from this person who is telling them that, hey, I have a question about what you did here. And they're thinking, well, who are you to question me? It happens, guys. It really does happen. So don't get caught up in that. Make sure that you proactively introduce yourself and ask if that's okay. Even if you have to send out that email and let them know, hey, here, hi, I'm your new coder and that kind of thing. That's okay too. And, you can ask, your supervisor or whoever, is it okay if I meet the providers? That would be, I would really like that, if it's possible. And if it is, great. And then what did you just do? You showed that you have initiative, that they didn't make a mistake hiring you, because you're not going to be one of those people who's, oh, it's so scared and milly-mally. These doctors, they put their pants on the same way you do, one leg at a time. The difference is they've been to school for 10 or 15 years, longer than you, right? Majority of you longer than you, okay? And they have all this schooling. But at the end of the day, they are still people. They are still people who have fears and strengths and needs and, you know, things like that. And it takes a special person, it takes that coder who understands that, to be able to be observant, be quiet when you need to be quiet, ask questions when you need to ask questions, write notes down, you know, don't overthink things. I know overthinking is easier said than done, but believe me, once you get past that initial 90 days, it gets much easier because you're going to get used to that. Okay? So if you follow these rules, if you follow this guidance, it's going to make the next 90 days a little bit easier on you. Okay? This is just the start of your career. You're going to start learning a lot of things. Okay? And one more thing about my providers is that when you start connecting with them, if you see that there's something that you can connect with them personally on, that's even better. Because sometimes you'll see, like, they'll have like their college or their, you know, team, their favorite team up or something like that. Or if you know something about that team, or if you know something about that college, that's great. Okay, I connected with my providers simply because I like fast cars. And one of my surgeons saw me in my sports car, and he was like, "Hey, do you have did you have this kind of car?" And I was like, no. Because he named another car that I will not mention, but I'm just saying, you know. And so I told him about my car, and of course everybody's impressed. And so, but that's how I connected with them. And it's the same thing that you can do. It's the same thing that you can do. But it takes a little bit of effort, okay? And you got to be able to pay attention to those things, okay? I'm just saying. So, with that said, the experience of being new is fun. It is fun when you stop worrying about it. Okay, don't worry about it. You're gonna make a mistake. You're gonna get feedback that you're not gonna really like sometimes from your supervisor or from your lead or from the auditor, and that's okay. Just learn from it. It's not personal. It may feel personal, but it's not. Okay. But even if it is, we need to not think about it as such, okay? Because do we really know? Do we really know? And you're there to get experience, you're there to do your job, and you're there to go home, okay? I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see you all next time. Bye.